Welcome to the Heart Rate Variability Podcast. In this podcast, we discuss the exciting science behind HRV and how you can apply it to your own health and the work that you do. Just a note, this podcast does not replace medical advice, and if you're going to apply this to your own life or others, please consult with a medical provider. Thank you and enjoy the show.
Hello, everybody, and welcome back to another episode of the Heart Rate Variability Podcast. My name is Jeff Summers. Good to be back, Matt. Today, I think we're going to focus on how to implement HRV in various environments. We've been really focused on obviously defining and talking more about HRV and what it means to folks and trauma specifically in the last episode. But what we really haven't gotten into yet is how to implement it and what folks really need to be concerned about when they utilize HRV as a tool in whatever profession they may be in. Mm-hmm. So I guess first of all, how are you? I just jumped right in there.
Good. We were talking about, I think all of our Los Angeles listeners will hate us at this point, but how the Nuggets are in the Western Conference Finals. So sorry to all the Clipper fans, and I know Laker fans will not be rooting for the Nuggets as well. But hey, it's great. Denver in Colorado, coming from Indiana, not necessarily naturally a basketball area. So when Denver becomes a basketball town, it always brings some joy to my life. So I know as a lifelong Nuggets fan, you got to be pretty happy there too.
Yeah, well, it's great to see the Nuggets get attention while the Broncos are playing, because that never happens. And yes, the Broncos just started playing in front of 0 fans last week. But it's an interesting sports climate with COVID. It's just different, man.
Yeah, absolutely. Absolutely.
Different climate in general, I should say. Sports is probably the least important of all of it.
I think everywhere is different. It's just that they don't televise everything. So
that's it. Yeah, you got it, man. That's it. Well, let's jump in here. Awesome. You've got a lot of background, in therapeutic care and running organizations that provide different types of therapies to different types of clients and constituents. So I know everybody's sort of heard your background in terms of why you get excited about HRV. And I think by now, hopefully all of our followers understand the importance of HRV. So what do we need to be talking about, and how do we design a good program to implement it in a way that's going to be effective and really meaningful and move the needle for organizations that are interested?
Great question. And so I want to start out, we're going to hit a few kind of subtopics here, but I want to just start out, if you think about yourself as a therapist or case manager, basically somebody in the social service, mental health arena, substance abuse arena, who carries a caseload of clients. And, to do this, really the ideal thing with the organizations we work for is trying to get folks to take daily morning measurements, if at all possible. Again, even once a week measurements give you some good data, but that consistent morning information gives you a great baseline to measure off of. So when we think about integrating HRV into our programming, what we really want to track is how are our interventions, how are our services impacting the health and wellness of those that we serve, whether we call them client, patients, participants, consumers, whatever label we might put on them. Because usually if somebody's in our care, we're rolling out interventions, whether that might be referrals, whether that's mental health intervention, substance abuse treatment, whatever that might be, is that we hope that we're improving their ability and their biology's health and wellness overall. We're hoping if somebody's coming from trauma, that trust and safety is going to help regulate that amygdala, sympathetic systems we talked about in previous episodes. So really, once we get that baseline established, Jeff, it really creates a foundation for us to measure somebody's progress in care. Also, like we've talked about in previous episodes as well, if someone has a setback, a stressful event happened in their life, HRV will more than likely go down pretty significantly. So it gives us that ability to reach out to folks even if we're not supposed to see them for another week or two. We see that drop. It allows us to provide those services, that support that we might otherwise not know is needed. So I think we've covered a lot of this sort of in our previous work, but the one piece that I do want to cover with this is one of the things that really got me excited about this when I was talking and being introduced to this was a study done around social readiness. For so much of our interventions, whether it's talking to somebody about making a behavioral change, like getting into a housing program, maybe leaving an abusive partner, substance use, or providing a mental health treatment where somebody might be addressing past trauma or hardships or shame that they've gone through. Are they ready to have an intense conversation? So if you go back to one of our first podcasts, is someone in a biological, neurobiological state to have a difficult conversation? Again, we're always going to be supportive. We're going to provide empathy, compassion. But if you're going to think about addressing your substance use, that's intense. Addressing past trauma, very intense. So, if you think about somebody, and let's just assume they've established that baseline of morning readings, what I'm really excited about is before I interact with them, having them take an HRV reading. Now, that's going to tell me if I look at that and it's at or above their average, hey, we can dive into some stuff. I don't need to worry too much about the co-regulation piece, talking about stress. I might want to do a little check-in, but in my mind, I know, hey, and I'm going to be upfront with the person, hey, your HRV is looking good today. I know we have some big tasks, some things to discuss. Is it okay if we jump in? But hey, we can kind of get to some of the harder work. Where I really think this can be powerful, especially for folks that may be struggling with trauma, is we don't want to, in our field, what we call re-traumatize someone. We don't want to push them outside that window of tolerance where it might trigger that traumatic reaction. So if I see somebody in our parlance, Jeff, with our app being yellow or red, so they're significantly below their average, I'm going to offer a lot of support. I'm going to really do a thorough check-in. I may need to maybe they can recover, but I may actually have to be okay with not pushing them as much as I was planning to push them, because I might actually do harm. Other things that I can implement is some mindful breathing techniques, right? We know that especially if someone's feeling anxious, can help energize. If somebody's not getting a good night's sleep or struggling with maybe some depressed states, doing that coherent breathing where I'm doing an equal inhale to exhale, kind of getting that sympathetic energy from that sympathetic system into it. If I see somebody coming in red, I'm probably going to want to take another reading after the mindfulness or after the support if I am going to try to jump into some of those harder conversations. If I know the person and they say I'm feeling better and their nonverbals looking better, I'm seeing them kind of perk up, maybe I'm okay without taking that other reading. But again, that yellow or red, especially if it's like 25% or below their average, you just want to be cautious, because this could be an alert to us that we might potentially put them in a place where they're going to be re-traumatized, and then we risk engagement, causing them psychological harm as well. So this is, Jeff, in our field of psychology, we had ways to kind of get to this. Obviously, you can ask somebody how they're doing. HRV allows you to put some objective information in this. We've had surveys, how accurate sometimes the feedback. I think we all question that. But the thing that I'm really excited about is this gives us and the client some data to really talk about, because instead of addressing past trauma or substance use, the most helpful thing I might be able to do is just talk about what's stressing them out. How's their last week been? So, this can really allow me to structure my interventions in real time. And again, that second reading, taking 3 minutes to follow up, maybe, hey, the mindfulness, the support has got them in a good spot. we might be able to rock and roll. Other times, hey, we just might want to talk about and keep you getting a plan for stress management, other things as well. So really cool pieces for those in the social service, mental health, substance abuse arena to really help us customize our interventions in real time.
Yeah, which is kind of groundbreaking, right? I
Yeah.
mean, it's one of those things that sounds simple, but until you've got a quantitative way
Yeah.
to sort of, as you always like to say, understand how people are feeling inside the skin, you're just going by nonverbal clues and what they're telling you, which isn't
Absolutely.
always the exactly accurate story. I mean, I know there's been many times where I've woken up and thought my score was going to be A, and it was nowhere close to that, right?
Yeah.
Better or
Yeah.
worse. Sometimes just you just
It's
never know. So
yeah.
it's eye opening,
Yeah.
and then you talk
Absolutely.
about, and then that's great sort of, day of kinds of things. And when you look at interventions and how you plan those, and you
Yeah.
look at sessions and how you plan them, but then there's just sort of the whole, how do you understand the quality of care you're providing over time,
Yeah.
right?
Yeah. Yeah, and is this intervention? That's where our dashboard plays such an important role as well, is looking at this intervention over time. Hopefully that their all time averages, their monthlies are all trending in a positive direction. Again, which as a therapist, the tricky thing with our field is if you're going to address trauma, we might actually see a significant decrease in HRV from pre-session to post-session because you've done some really hard work. You don't always leave a therapy session with more energy than you came in because, again, over the long term, we hope to see that trend. So, did we see a bounce back the next day, the next week? And so we can really measure this, but one of the big goals of services now becomes to see that HRV trend showing that this individual's nervous system is recovering, getting healthier, whether that's changing, maybe giving up smoking, substance use, getting in healthier relationships, getting in a better housing situation, getting those sort of things. All that should improve HRV. Maybe not right away, but
Right.
boy, what you want to do is you want to see that 7-day average trending in a positive direction. You want to see the 30-day average if they're in care for a long period of time, trending in that positive direction. So, it just quantifies what we are trying to do and can measure the systems of the body that we're trying to help heal, gain resiliency moving forward.
Yep. No, that makes sense. Like anything else in the body, you train it and it gets better. And
Absolutely.
after a training session, it's not in as good a shape as it was before. It's tired and
Yep.
it was hard, but you
Yep.
did it, and you've developed that resiliency.
Or the goal, like I said, this is one of the big things from a physical place is that active recovery idea is, okay,
Yep.
we may not be running today, but your body can still most days handle for most of us a 2 to 3 mile walk. So
Right.
you still can be so in, as a therapist, I might not go into okay, let's do the trauma treatment intervention. But it's not like we can't work out how to better handle stress. We can't maybe create a self-care plan. So you're still taking those, like I said, a 3 mile walk, the more I see the research, it's like probably the best thing a lot of us could just do is walk.
Absolutely.
Like
Yep.
we're not really designed to
Sit all day.
sprint, even those distance runners in Africa, our ancestors, it was kind of a trot, right? It was kind of, we are really good in walking, so good for our biology, so some days the best thing I can do for my body is if I'm in yellow or red is to walk, still have that active. So again, doesn't mean you can't do productive work. It
Of
just
course.
might be different work and still getting to that ultimate outcome for the individual.
No, no, that makes sense. And for all the therapists out there watching this, if you go to optimalhrv.com, you can learn more about what we do, how you can incorporate HRV into your current practice. And I know we're working with a lot of folks in that arena right now, Matt. But there's also a lot of other folks
Yeah.
that are in different professions, different applications, where HRV can be really, really important, both professionally and personally, not just for an individual, but in your personal life, just talking about family structure and things like
Yeah.
that. As a parent of a 3-year-old and a 1-year-old, these 2 little kids are going to have a little device on them
Yeah.
as soon as their bodies will fit it. Let's talk a little bit about that, because I think from a therapeutic standpoint, we spend a lot of time, and I think it's pretty clear. What about family? What about medical care, for example?
Yeah.
This is a biometric. You'd think the
Yeah.
medical community would be the first to jump on top of this,
Yeah.
and adopt it, and that hasn't necessarily been the case. But there's still a lot of great outcomes that can be provided by leveraging this technology and biometric. So,
Yeah.
top of your
Great.
mind,
Well,
what are some of the ones that you think are most important?
yeah, let's start with families. One of the other applications that I really drove me to not drop this whole HRV in the helping healing professions was my passion for foster families. I just have seen a great foster parent change the life of a kid. Total 180, as I like to say. You'd have to show me scientific evidence that a great foster parent is not worth their weight in gold for the great work that they do. But a lot, when the kids that go into foster families, high traumatic background, they're usually removed from their home situation because of a history of trauma, that their biological family no longer, for a variety of reasons, can provide them a safe place for them to grow, mature, and grow up. And, one of the things in the foster care system that just breaks my heart is a lot of times kids will blow out of placements, is our language for them. So they'll be in one foster home and that won't work out. They'll go to another foster home. That may work out for 6 months, then that blows up. Then they go to residential care. And some of these kids that so desperately need stability are just kind of re-traumatized by the system that they're in. And it doesn't mean like there's not great people trying to help them. It just,
Sure. Just the system.
It just gets too dangerous. Safety becomes an issue. So one of the real applications that I'm excited about is to help support foster families. But you can really just take the foster out and say support families as well. Again, that's kind of my passion area, but families. So families, we know, if you want to raise a healthy kid, that what we call in the child development, that secure attachment is so important. And that's the healthy relationship between the caregiver, the parent or caregiver, and the child. And Jeff, you're in the middle of watching this happen. Young kids, they're worthless. They really are worthless. A horse gives birth and the colt is up running around in like a minute or two. At least I think that's what I saw in a video once. Like, most even mammals can really do something of value pretty quickly after birth. Now they're still reliant on their parent, but they can walk, they can do some stuff. Feed themselves, all those kind of things. So as the young child, because we're so vulnerable, we're so dependent on our caregivers. And what happens is that, all I know about young kids is they're hungry and they poop themselves. That seems to be, what I like.
Pretty accurate. Yep.
Your youngest is kind of turning 1, and I got to kind of like have fun with him for the first time, like have a conversation, look at a book, play with toys, right? Not just kind of laying there as a poop machine, a cute poop machine, but now he's smiling, he's interactive, loved seeing him last weekend and just kind of having that kind of first kind of interactions with the kid, playing and having fun, and kind of having those kind of interactions. So what happens is, as we're young child, especially as toddlers and as babies, we can't take care of ourselves. So we cry, we get dysregulated. So our ability to cope with stress is very, very low as a young child because we depend on everything. So I poop myself, I'm hungry, I cry, dad comes, mom comes. I realize, even though it seems like my world's going to end because I'm covered in my own feces or whatever's going on with the baby, or I'm starving, I see mom's okay, dad's okay, and I start to learn that I'll be okay as well. So that's where that attachment really starts to happen. Now, with a toddler who's running around like a crazy child now too, that she can go out and explore the world. So she probably, and I still kind of can see this with her, you can see it happen is, you had some people over this weekend. She was kind of attached to you originally because, scary people coming over.
Everybody's
But,
new.
you could just, and now, I've watched her. It's very quick. Is now she's ready to play. She's ready to have fun. So now if she gets a little stressed out, she'll run back to you. And what you're creating there is a secure base. So with all that said, and eventually the kid's able to go off to preschool, go to elementary school, because I know mom and dad are kind of still there. Eventually they'll go off to college and develop to the point where they will no longer need you in the same way that they do to support their basic life needs like food and shelter. So what we're trying to do to help parents and foster families and kinship families, whatever the family structure looks like, is a care provider, a parent with a healthy HRV that shows that they have the emotional capacity. Again, stress isn't impacting them in a negative way to build that type of relationship, because that secure attachment, even though it can change later in life, people with what we may call avoidant, anxious, disorganized attachment, if they're in healthy relationships, that can change. That's kind of our template that we see other relationships in. So that's why attachment is such an important subject when we talk about child development. But a parent, and boy, I watch young, parents go through this. They're not sleeping. They're no longer like taking care, like as a non-breeder, taking care of me is usually my number one priority. Taking care of my wife, number two, and she takes care of me as well, obviously. And then I got a couple dogs that if you give them some food every couple hours and take them out to pee and poop, they're pretty much fine. Now all of a sudden as a parent, your life becomes about managing the stress of parenting. So we know that a parent with a good heart rate variability is much more likely to raise a child with good heart rate variability. So while attachment is a very complex process, heart rate variability that can help to say, hey, this parent's in a great state to be a great parent. And we can see that in the child as well. So like with foster families, what I'm really excited about, and again, with other families that might be under a lot of stress as well, is that if a case management person or a social worker is supporting them, they can check every day to see how's this family unit doing. And if we see spikes in stress or dips in HRV, we can reach out and provide proactive care so we can keep that unit healthy and intact. We can proactively provide support because, God forbid, abuse is going to happen in the home. It's usually a stress reaction.
Right.
I'm not justifying it, but usually it's a result of a level of stress getting overwhelming and then overwhelms my ability to cope. So then I take behavior that's not, good for anybody involved. And so if we can see that there's a higher level of stress, hopefully we can reach out and provide support to the family. Now, I also hope that this becomes a tool for families that aren't in any systems as well, because again, your health and wellness is as important as anybody else's. So I'm really excited for this tool to get it out there into family systems to help them track their own stress levels and again, ability to really be the parent that every child really needs to grow up healthy.
Well, it makes total sense. And as a parent, as I look at the kids getting older, what an interesting data point to have as they go through different phases of their lives. And, to understand, especially in the world today with everything being online and so much of, it's just changed so much, and we don't understand it as parents because we didn't grow up with it. We don't understand the stress that it causes.
Yeah.
When somebody's bullying you on a social media site or something like that, and to have this tool to say, okay, clearly something's going on recently because there's been a change in your ability to handle or recover from stress. Let's talk. Whereas, anybody, and I'm sure I'm going to go through it, but anybody who's had a teenager knows that they're not going to come to you all that often with those problems, And so I think it works both ways. I mean, as a parent, you're right. It's very clear. I can draw direct correlations. The times when I haven't been as patient with my 3-year-old as I would have liked to have been.
Yeah.
It's because something's going on, and
Yeah.
typically my HRV score was lower that morning than my average has been.
Yeah, absolutely.
So, talking about families, kids, what about the school environment?
Great. And so this is one of the areas that I still, my hope is that our next jump in technology, Jeff, takes us more into schools, because there's just some practical technological things that while I think some companies are looking at interventions, they're very expensive ones to put out there. But I see a classroom of the future, in schools of the future, being able to monitor the stress of their student body. I do a lot of work in schools. Usually if you call me in, you're not wanting to talk about the kid that sits there, behaves, gets straight A's. I'm the ones that's, the kid, if the kid's throwing a chair through the window, that's when you call Matt. So I've worked with a lot of kids with those behavioral issues, but it was really informative. I spoke my last kind of speaking engagement before COVID hit, was at Cherry Creek High School, huge high school here in the metro area. And I had all these kids who, looked like they were doing great, athletes because they were wearing their uniform. It's like, is this stress traumatizing me? Because I feel overwhelmed. I'm feeling traumatized, and can school do that to you? And I think that's a great question. I think it absolutely can. So, in the future, what I would love to see is kids wearing monitors that are doing a continuous monitoring. So one of the things that my wife does, and there's a big focus on social emotional learning right now, where you're really helping kids understand themselves emotionally. And, obviously that looks different in a first grade classroom than a junior in high school. But, like for my wife, she does this program where they identify, hey, I'm green, yellow, or red. So, what they're trying to do, because identifying an emotion is a very developmentally and intellectually pretty difficult task. To say I'm feeling angry before acting out for a first grader, it's not impossible, but it's really difficult. And it's difficult for some of us to do that as well. So, what I see the future being is that as if you think about my wife during transitions, because as we talked about states, very different energies needed to be out of kindergarten and then come in to do a math class. And that transition into a new state's difficult for a lot of kids, especially for kids that might have trauma and other things. So what I would love my wife to be equipped with is just on a tablet, she could pull up where the heart rate variability of her class is. So yeah, she's relying on self-report still, because you still want to have those, but she can monitor here. So she knows that, if a third of the class comes in red, a third in yellow, and only a third in green, she might want to do some mindfulness activities to calm folks down and get more people back in green. And then if Jeff and Matt are still in red, she'll want to individually check in with them. So this gives teachers a way to say, who's struggling right now, and to reach out again proactively before that leads to a behavior that gets the kid in trouble. Because one of the things I learned about the young brain, Jeff, first grader doesn't sit in class and say, let me weigh the consequences and the punishments if I act out, and choose, are the rewards better than the negative consequences before I decide this behavior. They're just reacting to what their biology is going to. We could also, even with high schools, probably the older they get, the more the kids might really get real-time feedback, and that'd be beneficial as well. To say, hey, which of our teachers have good classroom management? Do we see that, hey, they go into Mr. Bennett's class and, they may enter most of them green, but by the time they leave, they're all red, right? Maybe we need to give Mr. Bennett some support on how to manage his stress in his classroom. Seeing kids that are struggling so we can proactively reach out to them. Because, one of the things I'm learning about this younger generation coming up, the stigma of mental health for these kids doesn't seem to be like it was in my generation. They're,
Which
here
is
in
great.
Denver, they're saying, hey, we want mental health services in our school. They're advocating for more therapists, more counselors for this support. So if we can start to quantify some of this, destigmatize any of this even further, and get these kids proactive help. Like whenever I talk to a principal, I want to raise your test scores. I want that line out. Those kids sit in the principal's office. Let's knock that out let's get 2/3 of those kids back in class, because we've got proactive interventions. We're giving them that insight. So yeah, I think there's a lot of really cool interventions for school. Like I said, the technology is either not there yet. Some of it's just how do we stream multiple Bluetooth devices at once. Wearables are expensive, especially the 24/7 monitors. So it's still maybe 5 years out, unless somebody wants to throw a grant on our lap so we can develop some of the hardware. But we'll be there probably, I would say, in the next 3 to 5 years, where it's more affordable, at least for schools to implement.
Yep. Yeah, that makes sense. And yeah, I mean, there's just so many different use cases or applications in the school system. So what are your thoughts on sort of the medical world?
Yeah.
I guess, why isn't it being used more? Number one is probably my biggest question, and number two, where should it be?
Well, one is education. I mean, you had the story about when we were early on this project, asking a cardiologist what they thought about heart rate variability. And I believe the cardiologist may have said, I kind of heard about it in school maybe, until he went home and Googled it and said, you guys might be onto something. So one of the reasons it hasn't been used is because the technology hasn't been there to make it a practical tool. What I really see, Jeff, is this just takes vital signs to a whole different level. So you go in and you take height, weight, blood pressure, temperature. I think that's the normal. Sometimes they do that reflex thing, though. The older I get, the less they seem to hit my knees with that little tool.
Right.
But you're taking vital signs about what's your state, if that makes sense. So if I had a bad commute, or had a bad call in the waiting room, or got a crappy email from my boss, that's going to impact my blood pressure. So you're getting some information, and I'm not saying vitals are bad. They're data, but just imagine somebody taking a daily HRV score and coming in where the medical provider can say, okay, let's see where your HRV has been. So, let's say you're struggling with an illness. So when did the symptoms begin? And I can start to track how this has impacted HRV, things like diabetes, seeing how these conditions are impacting HRV over time. So where did the symptoms start that you identify? I can look at your HRV score. So instead of a point in time vitals, I've got this historical vital line that I can really see. Also hoping people that would see a drop in HRV might reach out proactively to their medical provider, say, I'm not sure what's wrong with me, but I can't explain this 5-day drop in HRV, and to go in and have those conversations. Also for people living with chronic or diseases, if, to alert a medical provider that, hey, their 7-day average is 30% below their all time, might be able to reach out to them and be proactive, have them come in for an appointment. And if they say, hey, I'm just under a lot of stress at work, well, guess what? Stress is not good for a chronic or any kind of illness or disease. So, hey, would you like a referral to mental health services to talk to a counselor? So I really think this provides that vital information. And then what you can do is then track progress of treatment, just like we talked about with therapeutic interventions. Track okay, we gave you a medication. How's that impacted your HRV over the next week or two? Because, most treatments should improve HRV scores over time. And if the treatment isn't working, do we want to switch treatments? Do we want to talk about different options that might be available? So I really see this as, the future of that vital sign is that you're getting this on a daily basis. I see future evolutions of our app. We've talked to people in the medical arena about maybe including things like blood sugar levels and other kind of things that might be those daily readings as well. So you can track those against each other. So really quickly, whether it's blood pressure, again, blood sugar level, insulin level, whatever it might be, all of a sudden you can start connecting other data points to HRV and really get a level of information that you can pull up at your fingertips that just gives you a much better understanding of what the person's dealing with than anything you can in a 15-minute medical visit.
Yep. Yeah, it makes sense. It's, to your point, sort of the next level in terms of preventative care, which everybody seems to be really focused on these days, and as well they should. And, there's a lot of options, and there's a lot of technologies and just a lot of things coming out in terms of how do we prevent illness and chronic conditions. And when you hear that dramatic drops in HRV predict 9 out of the 10 leading causes of death, most of which are health focused, whether it's mental health or physical health.
Yeah.
Why aren't we using this in a much more wide scale fashion? And why isn't this being more embraced by the medical community to say, hey, to your point, this is not an end all be all. It's just another data point that's valuable.
And I'm hoping insurers were really, like our interventions.
That's the next step.
Interventions less than $1 a day. Right. It's and I pay out of pocket for my insurance. I pay a lot.
It's not cheap.
So this would be such a small fraction. And if it can save, an expensive surgery or medical procedure later on down the line, maybe we can address some of these runaway costs. And this could really be a preventative, but a really data-driven one as well. So I really think HRV is going to be more and more integrated in now that, again, the technology is allowing us to do this in a very cost-effective way. This is going to be more and more a part of our medical preventive care strategies.
Excellent. Well, good discussion today. That was a lot. We got into some new topics, and hopefully some listeners, this really resonates for their own personal lives, or maybe something that they can follow forward on to friends in the various professions that we talked about.
Absolutely. And again, it's just, I'm interested if any of our readers have ideas or listeners have ideas about other ways, other populations to look at this. We would love to hear that as well. I think our list is pretty extensive, but even conversations we've had with people that have heard about us is getting us into different arenas we weren't expected to get into, which is really exciting because I don't care if you're a call center worker, somebody struggling with homelessness. We as a community have healthy people in our community. That's going to be good for everybody. So it's going to be good for the employer. It's going to be good for the person. It's going to be good for our healthcare system. It's going to be good for the health of our community. So it's just fun to have this exciting tool out there for folks.
That's it. Well, thanks, Matt. We'll look forward to another episode next week. But in the meantime, go Nuggets.
Go Nuggets. I'll see everybody next week.
Thanks, everybody. Take care.
Thank you for joining us for this episode. If you're interested in more information about HRV, please visit us at optimalhrv.com. Also, if you visit optimalhrv.com, you'll be able to sign up for our email list and download our free ebook, Healing with HRV. Thank you for joining us, and we'll see you next episode.